locked down.
That's right.
Like school's gonna be out, went from 3 days to 3 weeks.
Mm-hmm.
NBA season was canceled.
Suspended is the official term, but probably will not resume.
Yeah, is they supposed to come back on at a certain time? You think?
Well, they didn't announce the date. They just said it was suspended, which allows them the opportunity to resume games and have postponed some of the meetups, or even just essentially cancel the ones they missed and pick up later.
Okay.
But who knows what they'll decide to do at this point.
Okay, so what is the coronavirus? What is it?
Sure. So coronavirus is a virus that's actually been around for a while. I know there are probably many of you have heard that, like, if you look on the back of your Lysol can, it says coronavirus is one of the things that it kills. So coronavirus itself is not a new virus. It's very similar in some respects to the flu, which we've had for hundreds of years. The difference, however, is that similar to the flu, when we talk about, oh, there's a new strain, right? I'm sure many people who are watching remember the avian flu or the swine flu, right? Those were all different strains of flu, but they were the first time that particular strain had circulated in a human population. And so that's always scary because it means that nobody in the population has any built up immunity. And so anytime that happens, we are always concerned because it means that lots more people are then susceptible to getting sick because there aren't the normal ways that a disease could die off as it's trying to spread through a population when it meets somebody who has protection. So the example of this is if I happen to have contracted coronavirus, right, and let's say I come over to Rolanda's and spend some time with her, and let's say there were 2 or 3 other people here, right? In a normal situation, you might run into Rolanda. If this were the flu, Rolanda got a flu shot, and somebody else here already had that strain of flu, and somebody else here maybe also had a flu shot, or maybe there's a baby here that had been breastfed and was getting some immunity from breast milk. And so then I'm here and I have the flu, but I don't know, let's say I spend all the time that I was contagious with these 3 or 4 people. The flu's not going to go any farther than me because everybody here is immune. The challenge with a new virus is that you don't have any of those people circulating the community. There's nobody who's had an immunization because a vaccine doesn't exist. There's nobody who already has built up immunity because we've never seen this strain before. And so everybody I come in contact with is potentially can contract the disease from me. And that's what makes it particularly scary. It's just how quickly it can move through the population. So right now, what we know about coronavirus is that it's not more, deadly. It's not very, very much more deadly based on our current projections than some of the other viruses that are circulating. In fact, we've had a very bad flu season this year, and we've actually had kids in Sacramento County in addition to older adults and other folks who died. So it's not as if the flu season has been, a cakewalk this year. But what we do know is that it's likely that more people will be able to get sick with coronavirus because there aren't those people who have immunity. And that's really what we're worried about from a health standpoint, is the number of people who potentially could be flooding our healthcare system at the exact same time if there are like large events where one person can infect lots of people at the same time and they're all getting sick at the same time. So that's why you may be hearing people say something about like, let's flatten the curve. And essentially what that means is that when people get sick, there's often a peak in how many people get sick and then it drops off, and you want to slow that down. So you may end up with the same amount of people getting sick, but you want to make sure that they're not all getting sick at the same time. Right. And so part of the way you can do that is by limiting the number of people you come in contact with, so that if you happen to have been sick, you won't make a bunch of other people sick because you haven't been around so many people that it could just spread like wildfire through the population.
So is that why we're doing these the schools being canceled for a while, so that they think that would help?
Right, because if you think about how many students are in a school, and then you think about all of the people they come in contact with during the day, and not just in the school, but also then they all go home to their families, and then each of their parents or older siblings or whomever else also have jobs, and they go out and interact with people. It's very easy for things to spread really quickly when when people are out and about, engaging in their normal activities. And so that's one of the reasons why there's a big focus on large gatherings of people, because that's one one way where you had 250 people who showed up to something, they all go home, and now, you know, if let's pretend each of them lives with at least 2 other people. Now we're talking about 750 people potentially exposed, and then who do all those people got in touch, right? It can you know, move really quickly when we're gathering in large spaces. So that's one of the big precautions, is staying away from places where you're interacting with a lot of other people, because then you have the potential to spread it to a lot of other people.
Okay, so who's more at risk for this?
So right now, the preliminary data actually show that it is different from the flu in terms of who's at risk. The flu typically is most dangerous to our younger population, so our children, and our older population, so, you know, people over 65 or 70, as well as people who are immunocompromised. So those who have underlying conditions, maybe are going through chemo because they have cancer or are engaged in other treatments. They may be HIV positive. They may have other conditions that make them, you know, cause them to be immunocompromised, or those who have underlying like lung disease or lung susceptibility, so asthma, chronic obstructive pulmonary disorder, or COPD, things like that, right? In this case, it's actually mostly just the people who are older and the people who are immunocompromised, but we're not seeing the same level of vulnerability in our very young populations, which is I don't want to say nice, but in some ways it is nice, because at least it means that we're not as worried about our kids, because let's be honest, and I mean this with all the love in the world, kids are nasty. They don't have no respect for your basic public health hygiene measures, right? Really, really tiny ones put everything in their mouth. They have no understanding of bacteria and viruses and just general cleanliness and hygiene, right? Like if you let them, they stick their hand in their diaper and put it right straight in their mouth. Like they don't care, right? And so a disease like this, which can live on surfaces and can spread in this way, can be really hard to control in a young child population, because they will cough in your mouth and eat in each other's mouths, and will, you know, eat their snot or wipe it and touch some other toy, right? So it's really hard to keep things clean with kids. And so it's nice at least to know that the kids are not going to be the ones who are going to have the more difficult course of disease that's particularly dangerous. So that is one distinction from the flu. Kids are really susceptible to the flu and can get sick and die, and that's not the same case for coronavirus. But it's still something we need to take seriously, because we have a large number of people in our population who are, you know, over 70 and over 80, and who have conditions that would put them at risk. That, you know, our asthma population runs the gamut of ages. We have, you know, I've had several people reach out to me and say, my mom or my grandmother has this, that, and the other. You know, what should I be doing? And I said, you know, we need to engage in basic preventive measures to make sure that those folks don't get sick, because this will be a hard disease to handle if they do.
So why is everybody buying up all the Lysol and toilet paper? Is this part of the precautions around?
Well, okay, so the toilet paper thing is just hilarious. I can certainly understand how, if you know, you may end up being quarantined at home for a while, and if you're trying to limit your contact, because we do want you to limit the number of times that you're going to the store and going other places, especially places that have high traffic, right? So we do want people to limit that. And so there is, I think, a sense of like, well, if I'm going to be home, I need to make sure I have all the things I need at home. I know a lot of people, you know, in your household may go to school and go to work, and so you may be thinking about how much you use the toilet when you're outside of your house, and now you're going to be doing all of those trips to the toilet in your house, and so you want to make sure you have toilet paper. I think it became one of those things where, as it ran out, then the frenzy kind of contributed to
like,
itself.
oh my God, no more toilet paper.
Like, oh my God, no more toilet paper. And so then those people who were just on their regular cycle of purchasing toilet paper are now like, I can't find any toilet paper. I wasn't planning on hoarding it. I just needed some because we're getting ready to run out in the next week or so. So that's what happened with the toilet paper. It's, you know, just one of those things you always need. And so I think people's default is like, how do I prepare for an emergency? What are the things that I wouldn't want to be stuck without? But the toilet paper really has nothing to do with coronavirus. In terms of it, buying toilet paper is not part of like how you would prepare or prevent it. The same thing is true for bottled water. I think people just maybe like bottled water. We do have potable water in Sacramento. There are filters, so you don't need bottled water, but I think people just like to have it on hand. And maybe also if they feel like they need to leave, then you have a way of being able to have water with you. But I would hope, and this is one of the big things that I like to emphasize with people, is that if you have an emergency kit at home, you should have some water saved up for something like that. So hopefully, especially those who have a little more privilege of having disposable income, already have your emergency kit, so you're not rushing out in an emergency to buy more when the people who can't afford to stockpile when it's not an emergency are out looking for theirs, right? So part of the duty for those people who have more privilege is to stay prepared, so that the people who don't have extra money, who now have to buy things because they need them right now, are able to. And so that's just an equity and social justice issue that we need to really be mindful of, is what are the things that we do when we know there are inequities, so that there's enough for the people who can't prepare in the same way. And if we are going to buy extra, then we make a really big effort to make sure that we're sharing that with the people who don't have those same opportunities. But for the Lysol and the hand sanitizer, that's missing because some people are jerks. And so I'm sure some people have seen the New York Times article of the guy who bought up like 17,000 bottles of hand sanitizer and cleaning supplies and that sort of thing, and was trying to sell them at an elevated cost on Amazon, because capitalism is evil. So in case you were wondering, that's the overarching message is capitalism is evil. And so that's why there are major shortages, is because people saw what was coming and said, I'm going to buy up the supplies and try to sell them back to you at a profit. But also, hand sanitizer is helpful in between hand washing. Obviously we need to wash our hands as often as possible. When I got here, the first thing I did was wash my hands. And so I think it just makes us a little more conscious about our habits and what we're touching, and making sure that we're wiping down our surfaces that we touch frequently, like our cell phones. So part of the reason why I have a waterproof phone is so that I can wash it. And I try to, before flu season, I usually try to wash my phone once a day. Since, flu season was really nasty, and then coronavirus, I've been trying to wash it and wipe it down several times a day, to make sure that surface is clean. And I'm trying to be more conscious of where I place it, because a lot of us have the habit of just sitting our phones on the table or sitting them on, all these other places. We need to be mindful that if the disease if the virus can rest on surfaces, that when we sit our phones or our laptops or other things on those surfaces, we need to make sure we're cleaning them, wiping down our keyboards, wiping the bottom of our computers before we sit them in places, because that's a good way to be able to spread from surface to surface. So that's why those products are flying off the shelves, is because people are trying to be responsive and protect themselves and their families.
So what's up with all the face masks? I see a lot of people with face masks.
That's a great question. So people who are immunocompromised and at high risk will often wear face masks when they go out in public anyway, because they are their immune systems don't work the way that others do. And so they are trying to protect themselves from the virus. The challenge right now is that when people panicked, similar to the guy who bought all of the hand sanitizer, people are also going out and buying up all the supplies that they're hearing about, and the masks are one of those supplies. The challenge with that is that our healthcare providers need them, and the people who are actually sick need them. So I happen to keep masks at home for when I catch a cold or, heaven forbid, the flu, usually. And if I need to, run out to Rite Aid and get some medicine, or if I need to go to the doctor's office, or if there's something that I have to do while I'm sick, I want to make sure that I'm not infecting other people. And so those are the times when you may have seen me around town wearing a mask. But most of the time I try to stay at home, because that's the best way for me not to infect other people. But if I have to go out, I would wear a mask. And that's what we want people who are sick to be able to do, to be able to have access to a mask so they can go in and get the health care that they need, or get the supplies that they need. And so when we buy up those masks in bulk unnecessarily, we limit the supply for our healthcare providers and for the people who are sick. And so yes, masks can be good, but they're not good for people who are not sick to wear. Unless you're a healthcare provider, the goal here really is to stay away from as many people as possible, to wash your hands, and to engage in those preventive measures. And for the people to be wearing the masks to be people who are sick or healthcare providers. So, and part of that is just the sort of way that it changes your perception of risk. So when you're putting the mask on, if you don't fit it properly, and I actually saw a person yesterday who had a mask on, but the mask was like slipping down over her nose, and I was like, so then what she's going to be doing all day, because it wasn't properly fitted, is touching her face and pulling it up, right? And that touching your face is one of the things we're trying to get you to stop doing. So she's actually now at higher risk probably for contracting the disease if she wasn't just sick and wearing it for that reason, because she keeps touching her face. And if she was sick, now she's touching her face and then touching other things, right? And so you're actually increasing the number of times that you are touching the place that either is going to make you sick or help to make other people sick. So part of it is you want to make sure that if you are wearing a mask, that you've been taught by someone to properly fit it over your nose, and that it fits in a way that is actually protecting you and protecting the other people around you. And since most people don't need to wear one because they're not in that category of healthcare providers or people who are sick, we're just encouraging people not to do that and to be mindful of how often you touch your face.
So Cecile Million is asking, is there an estimate of what percentage of the U.S. will get this coronavirus?
Cecile, that's a great question. And my answer to this is it honestly depends, because if we engage in widespread, major public health preventive measures like social isolation or social distancing. I shouldn't call it social isolation. That's what we used to call it, but that's actually a negative thing. We don't want people to be isolated. But social distancing, as well as hand washing and avoiding large events, we actually could potentially change the course of the disease. So there is what we sometimes call the unmitigated R0. What that means is R0 is a wonky, jargony term that talks about how many people will get sick if somebody is sick. We also will talk about it sometimes as the attack rate or the secondary attack rate. It just means if one person gets a disease and then they enter in a population where nobody has immunity, how many people will get sick? And then we talk about a secondary attack rate being if I'm particularly sick and you consider all of my individual contacts, how many of them will get sick? And so a lot of that is determined by what we do, right? So if I'm washing my hands and staying at home, my secondary attack rate is going to be much lower than if I'm out in the streets partying, touching all the surfaces, right, and doing everything, and I'm just hanging out in large crowds. So how many people will get sick in the U.S. is going to be largely determined by what we do in the next couple of weeks. And so if we do more, we will far, underestimate the number of people that get sick. If we do less, it will be much higher than we anticipated. So right now it's really difficult to say, because they're like in California, we're having a little more of a concerted effort for everybody to kind of do these things, because the governor has sent down orders and a lot of the schools are closing and that sort of thing. But there are other places where that hasn't happened yet. And so we still have, the airports are still open, the train stations are still open, the bus stations are still open, and people are still traveling back and forth. So while you're doing all you can in a community, you don't really have a lot of control over who's coming in and out of that community and what's happening elsewhere. So I think California will probably may have underestimated how quickly things will spread because of all the efforts that are taking place. But I can't say that's going to be true across the U.S. because the federal response has been very slow, and many of the states also are still trying to get themselves together, and we're still moving back and forth.
So if somebody has a doctor's appointment, say on this coming week at the hospital, should they still be going?
So that's a great question. If you have a doctor's appointment, if it's a basic preventive, appointment like, hey, I'm going in for my annual, wellness check or something like that, I would say contact your doctor's office and ask. Because we are trying to limit the number of people who are out in public spaces and who are interacting with potentially other infected people. And so they may ask you to reschedule, or they may move you to telehealth, which is a great way, especially if you're just trying to do, a general, sort of visit, that you can do certain things. Obviously, they won't be able to check your blood pressure and some of those and take urine samples or blood samples, but at least they'd be able to check in with you about some of the other things and do some screeners, and you could reschedule your in-person appointment. If you're going to check on your diabetes or asthma or whatever, also call and check and say, what are the protocols? Should I be maintaining this appointment? Could I move to telehealth as well? If you are not feeling well and have made an appointment, make sure you call in advance, because they may ask you to take certain precautions before you come inside. Sometimes I have even heard of some of the healthcare providers, because they know masks are not widely available in the community, are actually asking people to come, let them know when you're outside in the car or however you got there, and they will come outside and bring a mask to you so you don't come inside and then sit in the waiting room and infect other people. So just call and ask in advance what the procedures are, to make sure that if you are coming in, especially if you are feeling sick in any way, whether that's the cold, whether that's the flu, whether you think it might be coronavirus, just call in advance to check and see what they'd like you to do.
Okay, one more other things. We're going to wrap up because I want to make sure you get to your next appointment.
Yes.
But the City Economical Relief Fund that they just released, what is that and who is that for?
Absolutely. So, many people know I try to be both a thorn as well as a pusher of our local and state governments to do what's right by people, especially when it comes to public health. And so I can actually say that I'm pleasantly, I will say surprised, but I'm pleased also with what the city of Sacramento has put together and passed on Friday, which is a plan to make sure that people are not evicted for being unable to pay their rents during this time, that small businesses and people who run healthcare or daycare centers and businesses that rely on large events, most of which have been canceled for the next 3 to 6 weeks, are able to maintain their businesses and maintain their livelihoods. Because the thing we know is that folks who are hourly wage workers, folks who rely on events for their livelihood, and are all now going to be in a position where their income has significantly gone down. And part of thinking about public health and health and wellness is not just thinking about how many people get sick from a disease, but also thinking about the overall impact of shutting things down and what that has on people's health and wellness. Also, making sure there are a number of kids when you shut down school who don't have a place to get food. And so those are the things when a lot of us were being critical of how schools were being shut down. It was because we wanted to make sure there was a plan in place so that the people who are going to be impacted by that are going to be protected. It was not because we're saying it's not a good idea to ever shut down schools. It's saying with every decision you make, there's a risk and then there's a reward. And sometimes, even though you're limiting one kind of risk, you're increasing that risk to others, and so the reward is very low, and it's actually lower than if you hadn't taken that step. And that's what we wanted to be cautious about, is that it's not a neutral decision in a place where everybody doesn't have paid time off, where people don't have basic employee protections, to say we're going to start shutting things down. And that's a scary thing. And some of the estimates right now, we've talked about how the disease will spread, are actually that the biggest impact of coronavirus is going to be financial. It's going to be the number of people that it bankrupts and that it significantly destabilizes financially. And so we do need to be thinking about that as a public health concern as well of this disease. So the city of Sacramento has done some great things in putting together this fund, and also helping to make sure that people are able to access paid sick time, even if that's not provided by your job, and unemployment benefits if your hours have been cut back because of coronavirus. So those are all really, really positive things that the city has done, and the city mobilized pretty quickly on Thursday to announce, and then on Friday to pass. And I believe that on Tuesday, the next city council meeting, they are going to work out the details of how the eviction fund is going to take place, because one of the questions that I asked them was, well, are you just going to be giving people cash to be able to cover their rents? Because as a city, you don't actually have jurisdiction over the individual landlords in terms of being able to tell them they can't. So how will this eviction fund, these eviction protections actually play out? And so that's what we will be waiting to see on Tuesday. We can't attend the city council meetings in person because of the governor's orders around gatherings of 250 people or more, but you can watch them online, and you can e-comment as well when the agendas are posted. So that's a great way. And you can also always email your council members and the mayor. So I strongly encourage people who have ideas around this or want to comment on the proposals that are out to please be sure that you do that, using the electronic means that we have.
Dr. Flo, thank you so much for coming in and talking with us today.
Of course.
Because this was really good. Just in the wrap up, give us 5 things we could do to just be safe.
Absolutely. So one is making sure that you are washing your hands all of the time. You should be washing your hands so much during the day that you're like, dang, I need some more lotion because my hands are really dry. If that's not happening to you, wash your hands some more. Okay, so that's the first one. The second one is wipe down your surfaces, your doorknobs. Think about the things you touch. I know most of us are being more conscious of how often we may have been touching our faces before. Think about other things you touch during the day and make sure you're wiping them down on a regular basis. If you have to drive your steering wheel and your gear shift and your volume button in your car, your cell phone especially, and your laptop, the things you touch throughout the day, make sure you keep your surfaces clean. The other one is engaging in social distancing. So really, I'm trying to actually count the number of people that I come in contact with every day, because I am trying to go out and do some community education. And so there are people that I'm keeping in contact with. And I'm actually counting and also keeping a list, so that if heaven forbid I get sick or one of them gets sick, I know how many people I've been in contact with, and I can make sure I can reach out to those folks to let them know they need to quarantine themselves. So that's an important thing to do as well, is just really try to limit the number of people you're coming in contact with every day. And while you're with them, to make sure you're engaging in basic public health measures to protect yourself. Some other things that you can do are to make sure that you limit the number of times you're going out to stores and other places like that. So when you go, don't buy things in huge bulk, but be mindful of like what you actually need and what you already have at home, and get those things only. And please don't hoard essential items, because there are people out here who were waiting for a paycheck so they could go and get some things. And when you snatch all of them up, they're not available to them. And it also increases the likelihood that people have to go to multiple stores, which again increases the number of people they run into. Consider doing some of your shopping maybe during off hours, so that you're not there when there are large crowds. So you're limiting, again, the number of people that you're exposed to. And also the last thing I would say is to, in all things, be mindful of those of us who have the least privilege. So our unhoused neighbors are especially vulnerable right now, because they don't have access to running water on a regular basis. And so they can't engage in these hand washing techniques that we're recommending for everyone. So that's, like one of the things I'm pushing the city on is to make sure that they install hand washing stations and not just giving out cleaning supplies, because yes, hand sanitizer is good, but it's not the same as good old soap and water, and we want people to have more access to that. Thinking also about how you may be able to help out in terms of donating food, checking in on your neighbors. There are folks who right now are more scared about how much money they're going to lose and how they're going to keep the shirt on their back than they are about getting the disease, and that is a valid concern, and we need to check in on those folks as well. And then the last thing is, we have social media. You're on it right now. So please engage with folks. One of the things we are worried about, especially in our older populations, is social isolation, and that leading to depression, and that really having an impact on our overall health and well-being. So I'm telling people, while you're at home, go outside and take a walk. That keeps you away from people, but it gets you a little bit of sunshine and gets you some fresh air, right? And so that's still okay to do. Just because you're at home and you're trying to stay away from people doesn't mean you can't go outside. It just means don't go into, a large building with a bunch of other people and hang out in close proximity. But you can still take walks. You can still, go out on the river and walk along. Like, go and do some things that are good for your soul. Binge watch some Netflix. Do it, on Facebook with your friends. Say, we're all going to watch, Coming to America at 11 a.m. and then watch together and comment on it and laugh at the same time. Like, do some things to make sure you're maintaining those human connections, especially if you live alone and maybe at home for a while by yourself. You don't want to be without that, because we are social creatures, and even the introverts among us need other people.
Wow, Dr. Flo. Thank you so much. You gave us a lot of really, really good information, and I hope that you all would, if you just came into Sunday Sit with Sisters, we're doing a short piece today, but I wanted to have Dr. Flo to come talk to us about this coronavirus so we can get it firsthand on what to do, what it is, and how we should proceed. So thank you all. Hope you have a great day.
And one last thing is that if anybody has any particular questions, I am an epidemiologist. I don't know if I said that up front. Lots of people call me Dr. Flo and aren't exactly sure what kind. So I'm an epidemiologist, and we study why people get sick and what we can do about it. So if you have specific questions, I am available on, most people hit me up on Facebook Messenger. That's kind of an easy way to find me. And I'm trying to be especially responsive to those messages right now. So if you have questions, you could feel free to reach out to me on social media and let me know. I will certainly tell you, to the best of my knowledge, how to help grandma with whatever else and what to say to this one and that one, and answering some of those questions. So please feel free to ask.
So you know what, Dr. Flo, I am trying to, my computer's been kind of slow, but I'm going to share your Facebook link so people can go right to you.
Perfect.
Copy. So I'm going to copy this over here And a lot of people said, perfect, great job, great tips. This is in the comments. So there's her information. I hope y'all have a great Sunday. Thank you again, Dr. Flo.
Of course.
All right, peace. I'm going to have to hit that button up there because this done went down.
Oh.
All right, family, let me scoot on.
Okay.
We good.
Get out of your way.
No, you good. I should have charged this thing up last night, but I didn't do that.